Welcome to my little blog again. I'm wanting to talk to you about how to speed up and maximise your home care results. As a normal everyday consumer, that is me. I'm wanting maximum results with minimum effort. That is honestly me. I am the owner of the salon and I know exactly how you feel because I own it. However, I don't get as many treatments as I should. I put everyone above myself. So let's not waffle on Lanny. That's my thing that I tend to do, is waffle a lot. What I want to do to you is explain something that's very underutilized in our salon and not a lot of people know about it and what it's about. So skin needling, you've obviously most possibly heard of it, but you don't necessarily know what it is. Well, let's just think of it in two ways. You've got a clinical device, which can only be used by professionals in salon, knowing the actual how to do it. And then you've got the home care device, which is everybody can use it with guidance to actually speed up their results and maximize their results. So I'm going to talk to you about the home device. So at Envy, we sell a home device. I hope we can see that. It's called the Skin Inject Dermal Roller. How it works in a very basic level, anyone who knows me knows I can waffle and waffle and waffle, so I'll try and keep this under 10 minutes. So how this works is it's a little rolling device with tiny, tiny fine needles. When applied to the skin in the right way, it creates very small channels within the skin, or something that we call micro trauma. Don't be scared of the trauma. So when the skin is proliferated with these tiny little micro channels, your body then sends out a response to that area thinking it's a wound. And one of the main things is to send out blood and white blood cells to actually see if there's any toxins in there and actually get rid of them. So it creates a flushing effect. Visibly, you will actually see your skin will go warm. So that's new, fresh blood with nutrients. Excuse me, there's a little fly there. Nutrients and vitamins and minerals straight into the skin, helping with that really good flushing of the skin. It also then creates the body to send more collagen and elastin to those areas to actually build up and fill in those micro channels, and that then gives lift and strength and support to the area. So it also stimulates cell division. So it wants to actually repair those traumas and channels, and it will start making sure that all the cells that are coming down are starting down in the epidermis and pushing up through the epidermis to come off as keratinized cells will start coming through a lot better. So you'll get an exfoliating effect and will speed up healing and things like that. So how does it work for skincare and at home use? Well, by creating microchannels into the skin, we're actually able then to get the products that we're using, which are really penetrative and really good for those dermal layers, like your retinol serums. They will actually be able to get down deeper into the skin at a much quicker level and really work better. It also will help speed up the exfoliation and the cell renewal process. Skin needling, like I said, can be done clinically, which is at a much larger needle or a longer needle, which will work further down into the dermis and create a different effect and a more exaggerated effect. That will have to be spoken to and directed how to use and how to manage the outcomes of that. Whereas needling at home can be done up to 3 days a week, and with one device, that device can last, if looked after carefully, up to 6 months. Now, the reason I'm going to talk about it today, about my skin, is I have major concerns with my pigmentation. So my genetic my background, I have some Asian blood, and so I generally will pigment not evenly. So I have a lot of pigmentation and freckling over my cheeks. And I've just got back from Bali, and no matter how much I use my sunscreen, I still got a little bit of amount of pigmentation. So I'm wanting to really work that. And using my retinols and my serums and my skincare is working beautifully. It's holding off excess pigmentation. It is helping with the pigmentation absorption and the melanocytes. However, I want to remove this non-invasively, not using laser. So the skin needling is going to work great with that. So let me explain to you how to use it. So we're selling the Skin Inject dermal rollers in salon. They are $80 and they come like this. So they are gamma radiated sterile and they should only be used for yourself. Do not share these, as they do create microchannels in the skin. Sometimes you'll get a bit of bleeding if you're going a little bit too hard. So they are penetrating the skin, so you don't want to swap serums and bits and pieces with other people. You're prone to infection. So it comes all beautifully and sterile. Now let me see if I can open this with my stupid nails on. And you've got this beautiful device with a little lid on. And how you clean this is you wash it in soapy water and then use something like some isopropyl alcohol to rinse it out, and then put your lid back on, and you've got that for 6 months of looking after it well. So that's the actual device itself. Now I'm not sure if you can see, let me see, that there is over a few hundred little micro needles on there. And so, like aerating the lawn, we're going to aerate our skin to allow for deeper penetration of our products and the lifting out of my pigmentation. How do you use it? So up to 3 times a week, and I would only use this product at night, because it does create that blood flow and that flushing. You don't want to have a slightly red skin, and you'll actually see how it works with me. So let me just put my lid back on. I don't want to damage these needles, so when I'm putting it down, I'm just going to put it down like that. You want to cleanse your skin first to have a nice clean skin, and you also want to have clean hands. This device can be used for all types of skin conditions. You can use it for aging and wrinkles, pigmentation, acne, enlarged pores and stretch marks. However, this device, a home device, isn't that effective on stretch marks, as the stretch marks are a lot deeper, so you'll need a clinical device to do that. I wouldn't recommend using a home device if you do have acne and pustules that are active, so that have bacteria present. You don't want to be creating micro wounds on the skin and transferring bacteria from one area to another area. So if you do have acne and you do have acne scarring, it's better to use it when you don't have active eruptions on the skin. You just don't want to do cross-infection there. So great for actually plumping out acne scars, great for lifting pigmentation, great for sallow skins and anti-aging. So how do we use it? Cleanse your skin. Don't do an exfoliation at the same time, as this is slightly tingly on the skin. You can use it 2 ways. If your skin is really sensitive, excuse my little puppy here wanting to know what's going on. What do you want? So you can use it 2 ways. If your skin is slightly sensitive and you're just starting out, you can actually apply your serum, and it always is better to use a really good serum with this, as you're getting the added action of the penetrative effect and the serum together. Again, just by using it by itself, you will get results. However, it's much, much more better if you're using it with a serum targeted to your skin concerns. And like I said, pigmentation, acne scarring, fine lines and wrinkling, aging, sagging, sallow skins, it will work for all of that. So I'd be using this device 3 times a week for myself for my pigmentation, and I would be using my potent retinol serum 3 times a week in the evening. If my skin is sensitive, I would use it with my roller at the same time, as it won't give too much of a rush of product into the skin. However, if you're wanting a better effect and your skin is tolerable, you would do your rolling first and then apply your serum afterwards. Now, if you're using something like a retinol, it will feel quite irritated. When I say irritated, you will see how much in a second. When I say that, it'll be tingly and itchy, and that will last for a few minutes. And it might feel like a little sunburn the next day, because your skin has just received that immediate response of serum and product very, very, very quickly. So how do we begin? So you want to use it in a manner of up and down, side to side. They do say there's a cross action like this, but in this device as well, we're just going to go up and down. And we want to start on our forehead, as that is the least fleshy part and will possibly be the most sensitive. So in your actual roller device package, you will actually get, before you do anything, a little explanation of how to use it, how the best way to use it, and when to use it. So for slightly sensitized skin conditions, apply treatment serum aligned with your skincare concerns and then do the rolling device. However, I'm going to do mine just the rolling device and then apply the serum afterwards so you can see how it goes. And it says here how to start. You want to support the skin if your skin's a little bit saggy, so my forehead isn't, and you don't put much pressure. 1, 2, and I'm going to go up first. Now on my forehead I can't really feel that. Around my eyebrow there I can feel it slightly. Now you can see already I'm slightly flushed. And the pressure is even, I'm not digging in at all. And it's actually quite pleasant for me. It doesn't feel spiky. That is my vertical. And now I'm going to do my horizontal. Now this should take about 3 minutes, but obviously it's going to take a lot longer for me doing this. And I do like to take it up over my brow. So you might feel tight over the next few days. Your skin might start being a bit flaky. This is all normal responses. Okay, so you can see how I'm slightly red. No pain, no blood spotting, very good. Now I'm going to go down the side. And just be careful going near the eye area. And then horizontal. It feels like something's rolling over my skin every now and again. I will get a little prickle. Like this side's a lot prickly. A lot more prickly. Maybe because I'm not supporting. I'll just go a bit higher there. And once you get used to it, you'll go a lot quicker. You just don't want to go over and over and over, because you will create too much of a response. And then I'm taking it up onto my cheekbone. And then across the way. Can you see how I'm looking a little red? Like a little bit of sun exposure? Oh, sorry, I'm going all over the place there, so I'm trying to find where I'm going. Yeah, this side's a little bit more, oops, that way, sensitive. This does feel a little bit more prickly. You can see how easy it is. And the key to this treatment, don't overdo it. If you're going to be doing it 2 or 3 times a week, you would, and within a day in between at least, to let the inflammation go down. You don't want to go too hard because it's continual. Now congested skins as well, by doing this, you're actually helping with congestion and bumpiness. You can go over the lips if need be, if you wanted that plumpier lip. And you could then use your hyaluronic acid on there, which is really, really really, really plumping and nourishing and moisturising. So on your nose, be a bit careful as it feels a little weird. Really get in there. So my skin feeling at the moment is quite tingly. And if you've had an enzyme peel or a glycolic peel before, it doesn't feel anything like that, as in intensity wise. And don't forget your upper lip, especially if you're a smoker. This is amazing for helping with those fine lines. Just be aware that it will possibly feel a little sensitive. Now I'm just going to go a little bit more on my pigmentation here. These are my fine little freckles, and this is my area of concern. Now I might find tomorrow that I'll be a little bit red over these areas and sensitive for a day or two. Lid back on, and now I will do my retinol serum. Now don't forget, with your retinol you want to do 1 pump to a moisturizer. 1 pump. Now that was 2 pumps then, because I just did it too much. Now I know this is going to be a little bit tingly, so then, and you will see my skin go quite warm, red looking. Actually, it's not tingling, which is surprising. Oh yes, it is. Do not waste all this beautiful product. Take it down onto your neck and neck, and you can very, very well use this on your neck, which I should have actually, because I've got a little bit of a chicken neck. And that is how you use your derma roller. This is something that I'm going to be doing now, as of today, for the next 2 weeks, to actually see how much my my pigmentation goes down. You can see a little bit more there. Now my skin feels warm, not tingly, warm. You can see this redness, so I know now that all that beautiful new nutrient-rich blood is coming to these areas and then flushing out all that stagnant blood. So I know these areas here are going to get really, really good nutrients. It's going to help with collagen building. It's going to help with elastin building. It's going to help with breaking up that pigmentation and pushing it out through the circulatory system. I also know that I'm going to get an exfoliating effect, and I know that my skin is going to look amazing. I can feel it working now. It's starting to tingle more now, and that is my result. If you are using your derma roller on the night time with your retinol, excuse that, that's my dog, my little one. Don't forget, your skin is slightly inflamed. That's the response we're wanting. We're wanting a little bit of inflammation so we can get this response happening. So inflammation also means protection. We need our sunscreen in the morning. Okay, so don't forget that. Don't be scared. It's something that, you know, if you're wanting to take your skincare that 1 notch up and you're wanting to see results quicker and maximum results, try the Skin Inject Derma Roller, or speak to one of the staff at the salon. Speak to you soon.